Welcome back. We're also following breaking news at the CDC after a stunning collapse of the agency's leadership. The White House says the president has officially fired CDC Director Susan Monarez less than 1 month into the job, following a standoff between Monarez and the HHS over her ouster. The White House says Monarez did not align with the president's agenda. The former acting CDC Director, Richard Besser, who I will speak with in just a few moments, told reporters that he spoke to her yesterday, and she told him that she was asked to fire her leadership team and rubber stamp vaccine recommendations that flew in the face of science. Today, White House Press Secretary Caroline Leavitt defended the move to fire Monarez and had this message for those within the administration who may be at odds with the president's agenda.
If administration officials are pushing back on the president's agenda, privately, publicly, however, should they fear to lose their jobs going forward?
Look, I think if you're doing your job well, and if you are executing on the vision and the promises that the president made to the public who elected him back to this office, then you should have no fear about your job. Just do your job. That's what this president wants to see.
Now, in addition to the now ousted CDC director, 4 top CDC officials announced their resignations yesterday, citing concerns about the weaponization of public health and the spread of misinformation about vaccines. Republican Senator Bill Cassidy, who chairs the Senate committee with jurisdiction over health issues, is now calling for oversight following the high-profile departures and urging the CDC to postpone a key vaccine meeting, citing serious allegations tied to practices at the agency. Joining me now is our team of reporters, NBC News health and medical reporter Berkeley Lovelace, NBC News senior White House correspondent Gabe Gutierrez, and NBC News senior national political reporter Sahil Kapur. So, Berkeley, let's start with you. The White House yesterday reiterating that Susan Monarez had been fired from her post. Her lawyer has a different view of this. He says that she's still the CDC director, that the president's got to tell her to her face, basically. Is it clear what her current status is, and what does it mean for the future of the agency?
Yeah, so I exchanged messages with the lawyers today, and they're maintaining that she remains in the role and she cannot be fired unless the president, Donald Trump, directly fires her himself. And so she's only been in the role for about a month. And so without a permanent position, there's a lot of concern about what Health Secretary Kennedy can do with this authority over the CDC, especially with his views on vaccines. And so just this week, he limited the COVID vaccine approval to people 65 and older and people with underlying health conditions. And then over the summer, he also fired all members of the CDC Vaccine Advisory Committee and replaced them with members who also have been known to be anti-vaccine activists. And so there's been a lot of anxiety from CDC folks there about what this could do to public health. There's a lot of misinformation they're saying that is being spread, and also hostility toward public health officials.
And then you have the other part of this in that kind of the entire leadership structure of the CDC resigned en masse following what happened to the director there. How disruptive is that going to be for them just to do the basic work of the CDC?
Yeah, so it's important to note also that just weeks ago there was a gunman that opened fire, fire there and left 1 police officer dead. So they were already shaken up from this, and there was already anger towards Secretary Kennedy about his past comments about the CDC, and then blaming him for growing hostility towards public health as well. And so we do have one official that we spoke with as well, one former official who resigned this week, Deborah Howard, who also said that public health is in danger because of what they call the Trump administration's misinformation.
Okay. We're going to play that sound. Let's play
it. Is America's public health in danger?
America's public health is significantly in danger. And Dimitri, Dan, and I chose to leave together to send that bat signal, essentially. We could no longer work at CDC because of these changes. We've had significant staff reductions. There's been scientific integrity and political interference issues.
Are you waving a red flag to the American people about what's going on at the CDC?
Very much so. And again, that's why the 3 of us did this together. If a single person resigns, it's a blip. The 3 of us are among the most senior scientist leaders in the agency. They oversee both vaccine programs, and I oversee all of our scientific programs at the agency. And so together, we are united that public health is in a crisis right now.
And so the agency is considered the world's public health agency, and so there's a lot of concerns about what this could do in terms of trust about information that comes out of the CDC at the moment.
And that falls right in line with what you were talking about as it relates to the COVID vaccine, because there does seem to be a lot of confusion over this now. They're changing who they recommend the vaccine be used, who should be using the vaccine. So if you're not under those requirements, if you're not over 65, if you don't have an apparent health risk, can you still get the shot?
Right. So previously it was recommended for everyone 6 months and older. And so Kennedy for a while has been mentioning that he would limit the COVID vaccine approval for the fall of this year. And so there is a little bit of concerns about what this can do with insurance. So the vaccines are approved, so doctors can prescribe it off-label. But what that means for insurance is a little bit muddy. And so depending on your insurance could offer a copay. They could pay for the vaccine fully, or they could not cover it at all. And so vaccines, the COVID vaccines in particular, are expensive. They're about $140 or up to $140 a dose. And so that's very expensive for people, especially also if they were getting it for free previously. So there's a lot of concern about access here for people.
It seems like at the very least there will be far fewer people taking the COVID vaccine this fall as those cases start to ramp up again. All right, Berkeley, thank you for that. Let's turn now to Gabe at the White House. Gabe, what are we hearing from the White House and the Trump administration about the removal of the CDC director?
Well, Ryan, I asked the White House Press Secretary Caroline Leavitt about all this earlier today, and she was pretty nonplussed. Look, the White House they are not backing down from this, and frankly, this is part of what they have been doing for the last several weeks, last several months, really, when it comes to administration officials in largely non-political agencies that they feel it just isn't lining up with their agenda. Now, I asked Caroline Leavitt about this. She said that the CDC director did not line up with the Make America Healthy Again agenda, and that is why the president ended up firing her. She said, Caroline Leavitt said that the CDC director said she would resign. That's what she told the HHS Secretary, Robert F. Kennedy Jr. When she did not, then the president fired her. Leavitt also said that the HHS Secretary or the president would announce a replacement, quote, very soon. But there are still a lot of unanswered questions about what led up to all this. I asked her specifically what the CDC director did wrong. She didn't directly answer that, only to say that she didn't line up with the president's agenda. And as you just heard in that interview with our colleague Ann Thompson, those other top CDC officials, they say that this is political interference, and clearly that interview is something that the White House just apparently wasn't standing for.
It's also important to keep in mind that Donald Trump picked this woman for this job just a few months ago. So it's interesting that that's their take on this. You know, Gabe, some Democrats in Congress are now calling for Secretary Kennedy to be fired as a result of all of this. Wow. Is there any chance that the White House moves in that direction?
At this point, we have no indication of that, Ryan. It still seems that the White House is still firmly behind the HHS Secretary. It is interesting, however, that President Trump has not weighed in on this controversy today, either on social media or on camera. We did hear from the White House press secretary, but Trump himself, who is notoriously not shy for making his feelings known on this sort of matter, he's not weighed in today. But we have no indication that the White House is in anything but completely supportive of Robert F. Kennedy Jr. Ryan.
Okay, Gabe, let's get the view from the Hill now. Sahil, it was just a month ago that Monarez was confirmed. It was along party lines. All these Democrats defending her voted against her a month ago. You know, what's the reaction been on Capitol Hill to this firing?
There have been very different reactions from the two parties, as you know, Ryan. Notably, Senator Bernie Sanders, the ranking member of the Help Committee, came out aggressively criticizing the administration over this move. He called for an immediate bipartisan investigation. He argues that this is all about Secretary Kennedy's anti-vaccine agenda. He called for an immediate public hearing as well, where Secretary Kennedy, as well as the fired CDC director and the resigned officials, can all testify and can all be asked questions. There are multiple other Democrats, as you just noted, are calling for firing Secretary Kennedy. Well, the problem is Secretary Kennedy is acting at the behest of Trump, and you can't fire the president. So this is a much bigger struggle that they have. Now, the chairman of this committee, Bill Cassidy, he said in a fairly passive statement on social media that the departures will require oversight. He didn't say what that would look like, but he did, as you noted, call to postpone the September 8th meeting for this HHS advisory committee on what he said were serious allegations about lack of scientific processes being followed. Cassidy's in a very, very interesting and tricky position here, given that he's up for re-election.
And let's expand on that a little bit, because Cassidy's been talking about oversight of HHS and Robert F. Kennedy Jr. from the second that he cast that controversial vote to confirm him. And yet there hasn't been any demonstration of rigorous oversight since he made that promise. So what should we expect when he talks about oversight other than this hearing?
Well, Cassidy's been visibly uncomfortable with Secretary Kennedy right from the start, right from the confirmation hearing, where he said publicly that he was struggling with the Kennedy nomination. He cited Kennedy's history, what he said was a decade-long history of being anti-vaccines, and Cassidy, as a doctor himself, feels this personally. He's heard from his former colleagues and those back at home about this. So what he's going to do about this, far from clear. I think it's impossible to miss the context that he's up for re-election in Louisiana. He's facing a primary challenge from a MAGA, Trump-aligned candidate, and he voted to convict Trump last time on impeachment charges, so he's not on the president's nice list right now. How he navigates this remains to be seen, but he is in an extremely important position now to decide what comes next.
And then there's, of course, who replaces Monarez. She skated through on partisan lines a month ago, and she wasn't good enough for this White House. How difficult will it be to get someone new confirmed?
Yeah, so the plot certainly thickens on this one because Republicans have a one-vote margin on the Help Committee. They didn't get any Democratic votes to confirm Susan Monarez, although some Democrats like Patty Murray say they were wrong to assume that she wouldn't stand up to RFK. Murray said that in a statement. But going forward, I think Democrats can easily look at this and say, RFK is just going to fire whoever is confirmed unless they advance his agenda, the agenda that Democrats don't believe should happen. So it's not just Cassidy whose vote would be at question here. There are two centrists on the Republican side on this committee, Susan Collins and Lisa Murkowski. If you don't get their votes, the next CDC director doesn't advance out of committee.
And then the CDC, as Berkeley points out, rudderless at a time where it's heading into flu and COVID season where they need to be at the top of their game. Berkeley and Sahil, we appreciate that from both. Joining me now is Dr. Richard Besser, the former acting director of the CDC and president and CEO of the Robert Wood Johnson Foundation. As we mentioned, he spoke to Susan Monarez, the now ousted CDC director, yesterday. So our conversation is timely, to say the least, sir. Just first, your reaction to the firing of the CDC director and also the resignation of these four senior officials. What are your biggest concerns right now?
Well, as you discussed in your previous segment, we're seeing an all-out assault on public health in America. I worked at the CDC for 13 years under Democratic and Republican administrations, and we'd never seen this kind of assault on our institution. There was always bipartisan support. What we've seen since January, with the loss of thousands of jobs from the Department of Health and Human Services, the cuts of billions of dollars to state and local public health, and now with the removal of the CDC director, the loss of agency leadership, we are really in a dangerous position as a nation when it comes to public health. This will affect everyone in every community, rural communities, individuals with disabilities, individuals with lower incomes who really rely on the public health system for so many services. This will be really, really challenging. And, unless we see the White House step up and recognize that they are responsible for the health of people in this nation, unless we see Congress come forward and really provide the oversight function that they're supposed to provide, we will continue to see a secretary who holds very fringe perspectives when it comes to science, when it comes to vaccines, when it comes to health. This will have a dire impact on people's lives.
And you did speak with Susan Monarez yesterday. What can you tell us about that conversation, and how is she reacting to her termination?
Yeah, I reach out to every CDC director in my role as a former CDC leader, as well as in my role as the head of RWJF, to look for areas for collaboration. And what she said to me is that she had a couple lines in the sand, which is so critical when you're in these roles. She said she would never do anything illegal, and she would never do anything that ran counter to the science. And she said the secretary asked her to do both. He asked her to remove the leaders from CDC, which is illegal to remove civil service employees without cause. And she was asked to endorse recommendations coming out of the Advisory Committee on Vaccines that she did not believe represented the best science. And so because of that, she said that she could not do those things. She was asked to resign and said she would not resign, and so expected that she would get fired.
I want to play for you something that Secretary Kennedy said today. Take a listen and we'll get you to respond.
There's a lot of trouble at CDC, and it's going to require getting rid of some people over the long term in order for us to change the institutional culture and bring back pride and self-esteem and make that agency the stellar agency that it's always been. I'm very confident in the political staff that we have down there now that they're going to be able to accomplish that and ensure the competent functionality of that agency.
What's your response? Is it the role of the political staff to restore confidence in our public health institutions? And could you make the argument that if there is a confidence problem, it could be in part to the leadership of the current administration?
You know, Ryan, it's hard to know where to begin with that quote. The problem we see at CDC is a direct result of the politicization of public health that took place during the COVID pandemic. It was a time when public health was demonized, was vilified, and we're seeing the outcome. Politicians saw that there was the opportunity to capitalize off of the fear that people were holding on to during the COVID pandemic, and any misstep that the agency took was rather than providing opportunities to understand how, in a learning situation, there will be changes in recommendations. You saw politicians capitalizing on that. The Secretary Kennedy has done more than anybody in our nation to undermine our faith in our vaccine system. He's doing the same now with public health. The biggest problem we have at CDC is that there are too many political appointments down there. The agency isn't being allowed to do its job, which is to use science and evidence and data to protect the health of people here and around the world.
At the very least, there must be an unbelievable brain drain happening in what was once considered to be a gold standard agency in the federal government. What's your advice now to these staffers who are still there, that are still working at HHS, and they likely feel conflicted about staying in their jobs, their service to the American public, versus resigning in protest over the way they see the direction of this administration?
You know, I hope that people stay. I hope that people continue to try and do the critical work. The 13 years I spent at CDC were some of the proudest in my career. It's an agency full of people who are working to try and improve the lives of people across our country and make sure that we move towards a future in which health isn't available just to some, but is a right for all. Public health is a very popular field for young people. But when they see politicians like Secretary Kennedy undermining the ability of public health leaders and public health professionals to do their work, it's going to make it less appealing, and we're going to suffer over the long haul. I really hope that Senator Cassidy and others continue to move forward with providing oversight to what is taking place, and call the secretary in and ask some hard questions about what is taking place.
Is that enough? I mean, Senator Cassidy's promised oversight, but he hasn't put a lot of substance behind that promise. Is just grilling the secretary in a public forum enough, or would you like to see even more?
Well, it's not just grilling. It's if you don't get sufficient answers, what kind of actions are you going to take? We've seen this secretary remove thousands of HHS employees without cause. We've seen billions of dollars that would be building up public health at our state and local health departments, money that would go directly to congressional districts, drying up. Congress has to do its job and recognize that this is a secretary who is undermining the health and safety of people in every community in America. In particular, rural communities that depend so much on public health are going to be at increased risk. And as we get into the COVID season, as the flu season, as you were mentioning, these things are going to be magnified. And if people are not getting a consistent, coherent message about the value of vaccination at this time, we are going to see a lot of people lose their lives to vaccine-preventable diseases.
Okay. Dr. Richard Besser, we're going to have to leave it there. Thank you so much for the conversation, sir. We appreciate it.
Thank you.
We thank you for watching. And remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.